Hey, good morning, good afternoon, and good evening, wherever you are in the world. Well, I am very happy to be here with Dr. Casper, Gavin Casper, who is over in Florida. And we're going to have a really great conversation about the veterinary industry, how you go from student to practice, and his experience, as well as some other cool things, because he practices great, natural, holistic, whatever the title is you want to use, integrative care. So welcome, Dr. Casper.
Thank you so much for having me. I appreciate it.
Yeah. So you've been in practice 4 years, right?
Yep.
Okay.
Correct.
So, that's a good amount of time. It's a lot of time actually, but you're, with regards to somebody who's been in practice 15 to 20 years, we get to have this unique experience with you where you still remember coming out of school.
Yeah.
And I'd really like to go down that road if we can first, because I'm just super curious about that. And I know like Dr. Ian Billinghurst, all the, Dr. Marty Goldstein, we all, especially privately, we talk a lot about what it's going to take to get to the young minds in veterinary school before the big corporations got to them and help them
Yeah.
see a path for themselves. So, yeah. So let's start there. So first of all, let's talk about just where you went to school and then what path you saw for yourself. How did you get into all these different modalities that you have, which is Chinese medicine, acupuncture, all that fun stuff?
Yeah. So I had a pretty unique, I think, experience. I wasn't those classic people that grew up wanting to be a veterinarian. And so I had 6 to 8 dogs growing up my entire life. My family was a really big dog family. And so we had a lot of experiences with different veterinarians, became very close with veterinarians as we kind of did some agility and dog showing. And so, we met a lot of people that were in your typical veterinary spheres, but those people that I think have competition dogs tend to look for other alternatives to make their dogs perform at a higher level, understandably so.
And
And
what
so
kind of
that's where I
dogs were
think
those?
so we had duck-tolling retrievers, which are like a small, more active golden retriever, more like border collie brain. So they're always going.
Yeah.
Great dogs, but definitely high energy. And
Yeah.
so we did a lot of sporting with them. I had a Sheltie as well, and so I did a lot of agility with her. And so originally, we were in those classic veterinary spheres, and over time started to learn more about holistic or integrative veterinarians. And so that was even before I really got much interested in it, but it was always interesting for me to see like, okay, there's other processes out there in this world that you wouldn't think of when you go to your typical doctor or your typical veterinarian. And so I went to the University of Florida for undergraduate, and originally I wanted to be an engineer. And so I took probably 6 to 8 months of engineering classes, and enjoyed it, but did not think it was the path for me. The people just didn't vibe well with me. The classes were just not what I ended up having a huge amount of interest in. And so I pivoted and ended up taking one animal science elective course. I was like, you know what? I like animals. I've grown up with animals. I had dogs. We had horses when I was really young. I was like, let's just see where this goes. And I took that one class, had a great professor. And that basically changed everything. And I remember calling my mom actually, and I was like, hey, I just took my first animal science class. Like, I really like this. I think I want to pursue this. And she's like, you've been known as the dog boy growing up. Like, what did you think? This is this is very par of the course, So it worked out. And so took, got my undergraduate degree there. And then I actually ended up going to vet school in Canada at the University of Prince Edward Island at the Atlantic Veterinary College. And so that worked out because one of the mentors of mine, basically, that we did dog sports with also went there. And so without that, I would have had no idea about the quality of education there, that it was even a school option. And so she spoke really highly of it. I visited, and I fell in love with it. It was really awesome because their class sizes are basically half as big as your typical veterinary class size.
Yeah.
And so, in my mind, I was like, okay, this is something that I'm going to dedicate my life to. As close to a one-on-one with the professor as you can get, I think is as valuable as anything.
Is that the majority of the reason why you went there in Canada?
Yeah. That was, I thought of the schools that I got into, I thought it would provide, number one, the best like life and cultural experience to get outside of the United States, live somewhere else. I'm from South Florida, so we have perpetual summers. So go somewhere where it's basically perpetual winter. And so I thought that was just going to be a really eye-opening experience. But the bigger portion was really just how focused the curriculum was on each student compared to your typical veterinary school class, which I think has a similar to kind of what you were describing before with industry, kind of like a funneling system almost, where it's like you learn and you go. And I thought this was a little bit more personalized.
Great. So when you right when you got out of school, what did you immediately know you wanted to get into those other modalities, the more alternative, quote unquote?
Yeah. So not specifically. I had a very high interest in it because of that dog sporting stuff before. I had a dog who developed cancer when I was very early in undergrad, and we actually went to the University of Florida Integrative Medicine department. And so that's where I kind of got some exposure to some of that stuff. And then I was really lucky in veterinary school that one of our professors was certified in acupuncture and chiropractic. And so he had a small rotation that you could take, some electives and stuff like that you could kind of get your feet wet. And so that's kind of what really opened my mind. And towards the portion of graduation, where we're doing our rotations, I managed to fit in taking the acupuncture course at the Chi Institute. And then right after graduating, I took the veterinary chiropractic course at Options for Animals in Kansas. And so by the time I was starting, my career, I already had those two certifications under my belt. And then it was just learning from there.
Hey there, this is Rob Ryan. I just want to say how much we enjoy making this content for you here. And if you are enjoying it, would you like our video down below? And would you subscribe to our YouTube channel? It sure does help us get discovered by more people like you who need information like this. And also down below in our description, the top link is to our trial pack. We hope you'll order one for your dog so your dog can have fermented superfoods that give them nutrition like they can't find anywhere else. Hard to get nutrients that are easily absorbed. Thank you very much. Now back to the show. Well, I mean, but what was the kernel? What was it, the dog with cancer that you grew up? What was the kernel that made you think, well, I need other options besides what vet school gave me?
Yeah, that was the original start in my head, that there was these other options out there to treat common conditions.
Yeah.
And so once I started learning about it, that it really opened up my mind. And so just in school, learning about, your typical disease pathologies, I would frequently go on and look up other ways that these things could be treated, whether it's human medicine, where there's usually a little bit more research, or animal medicine, where people are starting to extrapolate. And so that's where basically on individual research, I came across some of the veterinarians that you've had on your podcast that have been groundbreaking in a lot of these fields. And so just by listening to them, going to some conferences that I managed to squeak in my schedule in veterinary school, it really just kind of lit the fire and started my own self-learning.
So these veterinarians that you're referring to, that are groundbreaking, what do you think makes them groundbreaking?
I think they're just doing things that isn't taught in your typical veterinary school curriculum. And I think there are things that have a tremendous amount of potential, a significant amount of research. And then also most of them have little to no side effects. And I think that was the biggest thing for me, is that, in school, you're learning about all these drugs, you're learning about pharmacokinetics, and you find out that, okay, you take this, but you may need to start this other medication because this first medication is making, the pet feel this way. And, just hearing about all these side effects of antibiotics and steroids and all that stuff. And it just seemed like there must have been a better answer than throwing these things at every single pet you saw.
Yeah. I mean, obviously, most people who've watched our show and know us, I mean, we're obviously partial to something alternative if you don't have to use something that's got, negative side effects or is toxic. But obviously, like steroids and antibiotics, they're amazing,
Yeah. And they have their place 100%. Yeah.
Yeah. They're also overused. So how do you think about, I'm going to do this much of this other thing until I get into the steroid conversation or the antibiotic conversation, especially antibiotics. How do you think about that?
Yeah, I think it's case dependent.
Yeah.
The way that I think nowadays, and I think the first few years of my career, it was, I kind of had like my Eastern brain and my Western brain kind of, and it was always really hard to figure out when to use which client would be receptive to either of the two. And so now, my spiels have become a little longer when I discuss common conditions or starting treatments or stuff like that, because I think I'm now more comfortable and more willing. And my elevator pitch has improved to a point that I can now say, okay, we do have options X, Y, and Z that, may take a tiny bit longer, but have significantly less impact to your dog's overall health. And most clients, when you explain it that way, are like, you know what, let's try it. That sounds really great. I'd love for my dog not to have some side effects that could prolong the issue or cause other issues. And I think once those don't work, or if they don't work, then we start into that discussion of like, okay, let's get on plan B and see what we can gently add in to give us a little boost to get us to that point we need to be.
I want to come back to this client, the personality part of the human client. I want to come back to that. But what strikes me first is, so do you think about it this way? Like, obviously everything's very case dependent, very specific to every dog and cat and animal. But do you think of it like, okay, we're going to take it to we might not, but we can take it to the very end until this gets to like the red zone. This is how I visualize it. So I'm trying to figure out how you visualize it. When I think about my dog's treatment options, I think, okay, how much time do I have until I absolutely cannot wait another minute for antibiotics? And do I do those other things? So I throw the alternative kitchen sink at them.
Yeah.
Before that, how do you think about it?
Yeah, in a very similar way, I think. We try as many things as we can. And it is sometimes a little bit of a kitchen sink approach where it's like, okay, you have your itching dog with skin lesions. And it's like, yes, there is probably some bacterial, superficial issue right now, but that's obviously not the deeper issue. And so if we can address that deeper issue first, superficial issue may take a little bit longer to resolve, but you won't have that recurrence, or at least won't have the frequency of recurrence that your pet has been used to. And so that's kind of that discussion and where my head goes, where it's like, okay, as a client, I need you to understand your antibiotics that you use that create resolutions in 3 days. Sure, it's great. You don't have to worry about anything else. You give them and it's done, but it's going to come back in 3 months. And so if we, instead of, you're expecting this 3-day window, if maybe we push this out to a 2-week window, but we don't see resolution for another year, isn't that worth it in the long term?
Yeah. Right. That's very interesting. So let's go back to the personality of the patients. So, I've never been a vet, so I don't really know, but I've talked to a lot of vets, and what I know is there's sort of the willing and the unwilling, and then there's obviously a in between. And
yes.
So how much have you realized is you have to convince or sell the benefits, and the benefits being like, you don't have necessarily all the drawbacks. How do you sell the benefits to the gray area or the no? Just let's give them an injection and I want to be done with it. And so they nuke the problem, right?
Right.
Yeah. How do you think about those customers?
It's a little bit of a dance, I would say. I think, pretty quickly into my typical spiel, depending on the case, I can get some gist from the client as to like, are they open and receptive to this? Or is this like, they don't have the time for this right now and they don't want to come back in 2 weeks and they just want this to be done and not thinking about it. Yeah. And so I think you can pretty quickly tell what client that is. And so for those clients that it's like, I don't want to hear this whole spiel. I don't really care. I just want this done and not to come back.
Yeah.
you identify that, and it's like, you kind of change that try to spin that on its head almost. And it's like, okay, yes, I know you want to be done with it. I know you want to have this over, but I promise you're going to end up spending more money in the long term, and you're going to be here more times. And so if I can get them to realize that, and sometimes it takes 1 or 2 times where they're like, you know what, sounds really nice, I just don't have time for this. Let's just do the injection. And you're like, okay, we'll see what happens. And 2 months later, 3 weeks later, whatever it is, they're back. And it's like, I told you, like, we could do this injection again, or we can, delve more into what I was talking about before. And sometimes it takes those people a handful of times, but most, if not all, come back at some point and are like, you know what, this is getting old. Like, let's figure this out.
This is I'm fascinated by this topic of the signals that clients give veterinarians and doctors. Mm-hmm. And without even knowing it, I mean, this is super insightful, very, very helpful for people. And I hope people hear this. Like, the things you're saying and not saying, and the way you nod your head, all these things that veterinarians are experts at, they're going to put you in a little bit of a box because they're just meeting you. They don't get to know you, right? So I want people to hear this. So, talk to me about, I'll share my experience. I don't want to put you on the spot completely, but I think very helpful. This is very helpful. I tell my friends and my family, anybody who will listen, really, I tell them, look, make it really clear that you're very open to whatever will work with the least negative impact. And also let them know if this is the case, not if it's not the case, but let them know, look, I'm not looking to do the cheapest thing necessarily, because I think that a lot of vets are very sensitive to budget. And if they think that they're going to do, in their head, let's just be hypothetical, they think, okay, well, this is probably going to take 4 acupuncture sessions at, I don't know, let's just use a silly number, $100 a session, that's $400. But this shot is $85, and so they're making these micro calculations, right?
Absolutely.
Yeah. And I think, boy, like, how insanely amazing and sad is that? Like, what else? What are you going to do? Like, if you're a veterinarian, like, here's this dog, we'll just say dog right now for the example. And frankly, there could be a misread of the person, and there could be, but I just don't have an answer for vets. I mean, I think vets are doing the best they can to.
Yeah.
It's a spot. You're in a spot. So
absolutely.
Why don't you just give me a couple examples of like the signals that somebody can give you in an office on the first visit, and how you read those things, if you the best you can.
I think there's a lot of different, I think, which I know you've touched on before on your podcast, is like, I think there's a lack of psychological, whatever category you want to put it, teachings in vet school on like how to deal with people and how to read people and how to understand when someone says something or the way they say it and what the inclination is and what the underlying feelings, there's just so much to that. Yeah. And I think if you're, as a person, as a veterinarian, if your emotional intelligence isn't at that level, you may miss a lot of those things and misinterpret things. And I have plenty of colleagues and friends that, like, they say to me, this client was really mean, or this person doesn't care, what I have to say. And sure, are there those people out there? Yeah, there are. But more often than not, it's some miscommunication. And, whether that's on our part or their part, but it's our job to do the explaining, to advocate for the pet. And so I think ultimately it falls on us. And so a lot of times when I hear that, it's like, okay, well, what did they do? Like, what did you pick up that turned you off or made you feel like this client wasn't receptive to what you were saying? And so I think that is definitely a big part of it. I think, I've seen anything from people, coming in, sitting down in the exam room, making no eye contact, texting the entire time, like not just giving me nonverbal, just head nods, to people that, are overly attentive and, break down and interrupt almost every single sentence that I have because they have to ask some follow-up question because of, their level of worry. And so you have this like huge spectrum, and it really takes separating yourself from the emotion almost and trying to figure out, okay, like where can I direct this person to understand what I'm saying, and whether that's matching their intensity or, sometimes the complete opposite, and, being overbearing for a client that is really reserved. And I think it's weird because you have to play all this out in your head and then do it and then
practice medicine.
Right. Yeah. Yeah. And like understand all these things while it's all happening. It's all this happens in a 5 to 10 minute period sometimes. And so it is a lot. And there's a lot of, different differences between each person. So it makes it really challenging.
Yeah. Wow. So this is just like endlessly fascinating for me. So would you suggest that when somebody comes in for their first visit, they're meeting you, mm-hmm. This is a relationship. And I talk a lot about this, like developing the right relationship with the people that are important in your life, your doctor, your healthcare team, your animal's healthcare team. All these people they should be very, very important to you, because the experience that you have together this is what we're talking about. This could be the difference between you getting, having an open line of communication and having all the options or not.
Right.
Yeah. So it's incredibly consequential.
Mm-hmm.
I don't think people realize it enough. I think some might be watching this and will think, well, I think you're over exaggerating. I'm not. I'm actually under.
No, yeah.
So what would you say to new veterinary students that are coming in and thinking about, or maybe quasi curious about either chiropractic, acupuncture, all the things you're doing, laser, rehabilitation, all that stuff.
Mm-hmm.
What would you, with your perspective in the rearview mirror, what would you say to them about opening themselves up to a world that has other options?
Yeah, I think it's always really interesting because the clinic that I work at has a partnership or two with a few other veterinary schools, and so we have rotating interns pretty frequently, probably one every 2 months or so, and I think a lot of times, they come because half of our practice does a lot of specialty dentistry, and then we also do the other half general practice, and that's all they know. They didn't do, maybe a tremendous amount of digging, and they come in and, they see on my schedule, they're like, oh, you have an acupuncture appointment today. Like, I've only heard about that in school. I don't know much about it. And I think for me, getting these students, the biggest thing is just exposure for them. And it's getting them in my consults, watching them, having them watch an acupuncture session, having them watch a chiropractic session. When they go into our pharmacy, and I did this as an intern too, you go in and you're like, oh, what does this animal hospital have compared to all the other animal hospitals that I've been to? And they see, a huge shelf of ours dedicated to just herbal supplements. And so a lot of them are like, what even, they're names that I can't pronounce, like, what are these things? And so I think it starts with the exposure and just saying, there are other options out there. And a lot of times I wish I had these interns for longer because, they maybe see one consult with maybe one follow-up if we're lucky. And so they don't really see the long-term effects of it, or, they'll see the dog that I've been treating for a year and they're like, wow, he's walking so well. Like, what happened before? And I'll show them x-rays and they're like, how is this dog walking? And so they definitely come to see it. And I think even in that short period of time, it just opens their minds to like these other options that they never heard of, never saw. And I think a lot of them leave and they're like, okay, like, what was the name of the chiropractic school you went to? What is the name of these acupuncture needles? And they want to, get their hands wet. Wow.
Yeah. So your practice, your particular practice focuses quite a bit on rehabilitation, it seems to me. Is that a fair?
Yeah, I don't have a full setup where we can do, little obstacle courses and underwater treadmills. But I have, the typical setup for senior pets, I have a setup for, a lot of agility, conformation, fly ball dogs, enough that we could do that. So I can't, necessarily get a full rehab on a dog who's had knee surgery, for example, but, definitely have the space for laser, chiropractic, acupuncture sessions, all that fun stuff.
Yeah. Yeah. Okay, you don't have that setup, but tell me where the majority of your practice is. Are you just doing general wellness? Are you like a GP, general practitioner?
Yeah, I'm just a GP. Mm-hmm. Yeah. And so, it was an interesting blend to, I'll go from, this dog, I'll go from a spay to then, a classic derm appointment to then doing acupuncture on this 16-year-old dog that we're trying to be able to get to walk again, back to a vaccine appointment, and then back to, this dog that I've been treating for acupuncture for, liver enzyme elevations. And so like, it's all over the place, but I think that's what keeps me on my toes, and it makes me always have to think, which is pretty cool.
Yeah, that's great. So what, when you look at like just rehab, where do you see the best results? Like which one of your tools do you find that you've seen the most beneficial results? Obviously knowing that every animal's different.
Yeah. I think, it really is dependent on what's going on with the pet. But most of the time in most sessions, I'd say 75 to 80% of them, I'm kind of doing a little bit of like what we talked about, like a little bit of a kitchen sink approach where it's like, okay, you're going to come in, I'm going to do a chiropractic adjustment, which is probably going to decrease the amount of needles that I'm going to need to use for acupuncture, which might make my acupuncture session more beneficial. While they're getting acupuncture, I'll usually laser specific areas of the body that I identified that need some sort of laser treatment. And then once I'm done with that, I'll usually leave 1 or 2 electromagnetic frequency loops on them while the acupuncture session's going on. And so it's kind of hard for me to say, like, which do I prefer, or which do I think is the most effective, because ultimately they all kind of work cohesively.
Yeah. Well, the other thing, some people don't like this kitchen sink approach because they want to know what the thing is
right.
that worked. Like,
which I've had plenty of clients say. It's like, well, how do you know what'll work if you're doing all of these things? And my answer is always, does it matter because your dog's walking? Like, what does it matter?
And the other thing is, all those 3 things you mentioned, I'm going through in my head and I'm going, okay, so if this didn't resolve the issue, I also got more circulation in my dog from acupuncture, chi balanced, because that's probably what you're doing. Like, why is that a bad thing? That's kind of an amazing. So I'll do that calculation in my head. Then I'll go, okay. And then the PEMF, which that's also really circulatory. It's right. It's like, I hear that it's flushes out, at the cellular level, all the debris and all that sort of stuff. So you're getting these ancillary benefits from that. And then what was the other thing we just talked about? Acupuncture, PEMF, chiro. Like, wow. Like, show me any person or animal, dog, that doesn't have something out of place. And what I do is I look. Most really great vets are not going to do chiropractic if your dog doesn't need it. So on some level, a neck's out, a shoulder's just a little bit out. So my dog's going to feel great on these little, just more flexible and more loose.
Right.
Even if it may not help this symptom.
Specific condition. Right. Yeah. Absolutely.
Yeah. So there needs to be in a vet practice, there needs to be some mechanism where you go, okay, well, primarily we're coming after this symptom, but I just want you to know what the other, and I'm not just speaking to you, I'm speaking to other vets who are, I'm not, certainly not telling you how to do your job, but it's like, we're going to go after this symptom, but guess what else you're going to get? You're going to get all these other benefits that are additive. They're just, it's extra bonus points.
Right.
So you're not wasting your money. You're also not really worried so much. Do you want to keep coming back and you want to isolate? Is it acupuncture? Is it chiropractic? I don't want to,
Right.
So, I guess I'm in between the person who says, just give them the Cytopoint shot for the arthritis. I don't want that. That's the nuclear option, the Oppenheimer option.
Right.
I also don't want to come back and if my dog is suffering a little longer and then I'm also driving back and forth and I'm wasting time. No. I want to address the issue as fast as I can for my dog, and also just make sure that I'm not wasting any time. I want to make sure my dog's feeling great and I'm not wasting a bunch of resources just to isolate that it's acupuncture. Because the truth is, you may not know it's acupuncture next time, but you might think it is. Because, right? So, yeah. So it's kind
of changes.
Like, why do you even want to know what it is that does it this way? I'm going to use my vet's experience and intuition to say, okay, well, they think it could be one of these, he or she thinks this one or two of these things could work, but we're going to do all three. Great. That's why you have a vet. You're using them for their intuition, their art, the art and science.
And it's funny too, because a lot of people, will say that to me, like, I want to know which one it is. And when you flip the book and, this same client or a similar client's going in for, a skin visit with their typical veterinarian, like they're getting put on an antibiotic, probably an anti-inflammatory, and probably also getting a Cytopoint injection, and maybe sometimes a steroid instead. Like there's a combination of things. And so I don't hear people say like, okay, but which fixed my dog? Your dog feels better. That's ultimately what matters. And so that's, a lot of times what I'll kind of relate it to is like, you've done this before, just differently.
Good for you. Yeah, good for you. And then the other thing too is all these costs are like, people don't see the downstream costs. Like you got to get sometimes liver, kidney tests to make sure that the toxicity isn't overwhelming. I mean, it's horrible stuff. And those are costs. Those are real costs. And then you've got another visit. What do you call that? An office visit. You've got all these things that just keep stacking. It's just, I also find that vets with a holistic mind or natural integrative, we can use all these things.
Yeah.
They're all about saving money. I mean, they're all like, they're not here to bleed you with like, there's something with the Western model that I've seen. This is my experience personally. There's something with the Western model that is, I don't even know how I can think about this or why this is, but it's definitely more of a churn. There's a financial, it's not in the forefront in these vets' mind. Nobody's trying to steal money, I don't think.
Right. No, I don't think so either.
But there's a mindset of like, we're going to boom, 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 boom. We're going to do this.
I think it's because it's very like formulaic. It's like, you learn. It's like, okay, you start it, I got to check it 2 weeks later. Then I got to check it again a month later. Then I got to check it again 3 months later. Then 6 months later. And then every 6 months, maybe every 3 months, so you're 100% right. There is some.
Yeah.
And it's not the driving force, but it's just the way you've been taught and what you come to do, because that's what, that's what you were taught back in the day.
Yeah, it makes total sense. So let's go back to rehab. So when you have like an older dog, and because I really love senior dogs. I mean, who doesn't?
Yeah, same. Yeah.
What would you say gives you the biggest bang for your buck when you send people out to probably some rehab facilities for underwater treadmills and all that? What do you see that works the best for older senior dogs?
Yeah, I mean, I think it depends on what level of severity. I think usually we're talking about joints here, their mobility is. I think some dogs, maybe early on in the disease when they're just starting to lose some muscle tone, maybe their reflexes are a little decreased, or rehab, like a human would go to, physical therapy is super beneficial because you can prolong that time where you're starting to see those reflexes decrease. But, at the same time, all of that physical therapy can only be boosted with acupuncture and chiropractic. And a lot of times these dogs have chronic joint conditions on top of it. And so all of a sudden they're using muscles they haven't used. They're using joints they haven't used. And so all these other pains and issues are starting to pop up because they're just working harder than they've had to. And so a lot of times, like, I have plenty of clients that will go to a facility for that type of intensive physical therapy. And then, maybe a week in between or the other half of the week will come visit me and we'll do an acupuncture session or we'll do chiropractic, because there is so much I pick up afterwards just from that. And so, at that initial stage, I think it's a lot of that. And then, as we start to decrease, it sounds sad, but I've had clients that have been quote unquote fired from rehab places because, they're like, you're kind of at an end stage here. There's not much more that this type of physical therapy rehab can benefit. And so that's, an opportunity for me to jump on. And it's like, listen, like, this isn't the end. Like, you're coming, those times you're going to physical therapy, you're now coming to me for an acupuncture and chiropractic session.
Different options.
Right. Exactly. And I've seen dogs do better from that than those rehab sessions, I think, because sometimes they're a little bit more personal or fine-tuned, and I'm picking up little things on that dog every single time I see it.
Yeah. Do you do the electroacupuncture?
I do. Yep. I try to do it as much as possible. Yeah, it's amazing what it does. I didn't do it initially, and then I was finally convinced to do it, and I started doing it, and I was like, this is, it speeds up what you usually saw probably about 3 times. So, session 1 is basically like session 3 when I do these things. So it's pretty amazing.
Yeah. That's a great point too. You want to find somebody comfortable if you can with that, because all acupuncture is, and I'm going to defer to you, but what I understand acupuncture to be is really just you're rewiring the electrical system of the body. You're kind of how would you explain it?
Yeah, I think you're aligning what has been malaligned, I think. And I kind of use that same comparison with chiropractic. I think you can kind of, and this goes back kind of to the client, it's how you talk about it. Like, I have some clients that want more of the, what I'd classify as Western version of these explanations, where it's like, okay, in every single acupuncture point, there's a nerve bundle, a blood vessel, some fascia, and I'm, stimulating it with a needle. And so that brings all this blood, that type of discussion. And then on the other side, I have some clients that want to hear more of the, like, balancing the chi and the elements and creating that kind of harmony that has been malaligned. And so it depends, but there's that's kind of the theory behind it, that you're re-stimulating things that haven't been stimulated, and as a result, things are kind of lining back up to where they should be.
Yeah. I also think people should get comfortable coming when they don't have a big issue. They should be coming for, I call them tune-ups. Like,
yes, 100%. Yeah.
And I think also, like, when you go to a vet for a visit that's wellness and true wellness, and, they usually typically, when they do the intake, they say, what's going on? And you say, nothing. I'm just coming for a tune-up. I just want to make sure the neck's good, the joints are good, we just throw a couple needles in them.
Right.
That's what I do. And when you do that, don't you think it sends like the right message to the vet?
Yeah, absolutely. I think it shows that you, I don't want to say care more, but there's a deeper level of understanding about your pet that you're like, I know everything looks good, but I'm sure on a deeper level, there are always things that can be improved. And so I think it definitely does show.
And it would seem to me that you on these times when you're not super honed in on some problem, one issue, or whatever the symptom, you get to know the person a little bit better, and you get another opportunity to put your hands on the dog, get to know the dog better, and you go, hey, this isn't them at a pain level 9. I get to see how they are. There's some benefits to that.
Yeah, absolutely. I think that's, kind of touching on the interpersonal thing again. That's one of the best parts of the holistic approach, I think, is that I do see clients and patients more frequently as a result. And so you do get to know the dogs a lot better, or the cats, and you get to know the people on a deeper level too. And it just opens up a lot of avenues for trust, for treatment options, for, and like kind of like what you said, like, I've always seen this dog limp this amount, and today we're limping way more or limping way less. And it's like, if I hadn't seen this dog every single week or every 2 weeks for the past 2 months, I don't think I would have been able to see that small difference.
Right. Brilliant. All right. So let's move now into, well, some people thinking, well, what dog wants to go to a vet's office? Well, personally, all my dogs love going to the vet, and it's not because they get treats, but that does
always helps. Yeah.
It does help. Yeah. But there like the best holistic vets, the best natural vets. There's some weird good energy that's in these practices that isn't in these other practices, and I don't know what that is, but the dogs do. And like I've had dogs that don't want to go in certain practices. At the beginning, when I got my first dogs as an adult, I was in these practices. We don't, but the other ones, like, my dog Gus now, he whines and he gets honestly ridiculously happy. He's not even himself. He barks and yelps.
It's an out of body experience.
Yeah. And part of that is the treats for sure. But he just loves this guy. He loves my vet. So let's talk a little bit about fear-free and how do I think about, like, let's talk about it from the perspective of the pet owner, what they get with a fear-free vet. And then maybe let's just talk a little bit about being a vet that has that integrated into their practice.
Yeah. I mean, I guess, for those who don't know, the concept of fear-free is basically reducing fear, anxiety, and stress in your patients when they come in. And so there's like a bunch of courses you can take on it. There's certifications, but I think it is more of a mindset. It's not something to add onto your resume. And I think for me, that description of what you're saying is definitely way more frequent than not for most of my clients. And they'll come in, and I can't even tell you the amount of times I've heard a client say, like, it's so weird. I pull up to the animal hospital and my dog's excited. And so they're like, I've never had this happen before. I've never heard of my friends or my family have dogs that are excited to go to the vet. And it's a really rewarding thing to hear because, even for us, like when you think of your typical, it's like going to the dentist. Like no one wants to go to the dentist. You always have that fear. And so, And so that's what most people's kind of concept is for their dogs or cats to go to the vet, that they're going to have a terrible time. They're going to regret it. It's not going to be enjoyable for them. They're going to be stressed. Their dog's going to be stressed. Their cat's going to be stressed. And so to kind of flip the script is just extremely eye-opening for people. And so, for me, and I agree with you, I think a lot of holistic veterinarians are almost on like a slightly different wavelength than your classic veterinarian. And I think, the patients pick up on that I'm not going in there with the aim to poke them with something and have them go home with a pill. Like there's a lot more to what I'm trying to get from them emotionally, physically. And so I think there is an added level of comfort on top of that, fear-free approach.
Yeah. So what are you doing differently that other vets may not be doing?
So I think it's a lot of things. I think there's more physical or like tactile things. Like I don't wear scrubs. I don't wear a lab coat, so I think come in looking like a typical person that they would see on the street. I don't rarely do exams on tables. I go into the room and immediately sit on the floor. Most of my assistants are fantastic, and they know, the second my butt hits the floor, there should be some sort of treat on the ground, some sort of toy on the ground. And it just becomes a much more welcoming environment. I always have clients that are like, if I went to the doctor and they gave me a lollipop when I first got there, like I'd be a much happier person, And so it's kind of that same approach that it physically, the dogs see something different. I think as a result, there's probably a different smell and a different grouping of pheromones that are given off in the hospital that dogs waiting or dogs even first coming in pick up on as a result. So it's kind of like a whole feedback mechanism there.
Yeah.
And then, once they're there, they're getting treats. The exam is usually really casual. Half the time I have them on their back, like rubbing their belly, and, I'll quickly listen to their heart while we're doing that, or maybe flip up one ear. And so a lot of times for me, my exam may not be as regimented. It's not like nose, eyes, ears. And, I make the dog accommodate to what I want to do. And so the dog's on the floor and it's like, okay, he's on his back. Let me look at his abdomen. Let me palpate his left knee because he's here. Let me look at his right elbow. And then let me look at that left ear. And then he rolls over and it's the opposite approach. And so I think that, even just in the exam, there's so much less stress. And it just sets up so much more opportunity to really get the dog to be unguarded, which I think is a lot of problems that, a dog comes in limping and they're so anxious that fear instinct kicks in and they're like, I can't show this weakness here because, I'm in prey mode. And so when they're relaxed, it's like, oh, I do see that really mild leg kick when they sit down, as opposed to them not even wanting to sit because they're so nervous, and it creates such a big dichotomy.
Yeah. Yeah. The holistic word, but really WHOL, whole.
Yeah. Integrative. Yeah. Whatever term, you want to use. Yeah.
Yeah. That I think you came upon, you stumbled upon something I think that's really important to come back to, which is, the whole practice, if it's integrative, holistic, whatever, the whole practice, the mindset, the way that your folks in the front take a dog in, talk to them, there's the energy, pheromones, scent, all that stuff and it's so different going into these practices versus the other ones. Because the other ones usually, typically, you'll hear dogs barking and like kind of in panic mode, and they're in cages because that's
right.
What they do. Like there's a whole different
vibe. And it's absolutely, and it's, I agree 100%, and I think it's even more unique in the type of practice that I work at because it is kind of like a trifecta where we have this specialty dentistry portion, which I'm not, a huge part of, but that bleeds into this general practice and that holistic practice side of things. And, for me as being the medical director there, it's really important that like everyone is on the same page here when it comes to these patients, because that dog coming in for a dental consult that I'm not probably ever going to see is going to impact the dog next door who I'm trying to do an acupuncture session on, and it really is a whole hospital approach. Absolutely.
Yeah. Yeah. And the sitting on the floor and you were bringing me back to decades ago where you had to lift the dog up and put him on a cold table, and they're already put off. They're like, why am I up here? Like,
right. Never in a dog's life is it put on a cold table except at an animal hospital where something bad is going to happen. It's just not something dogs do. Yeah. Or a cat for that matter. Even worse for a cat. Yeah.
Yeah. Oh, those poor guys, But so it is really, really fascinating to be thinking about that. And honestly, I've never once thought about that until today, is just this whole energy vibe. I mean, I've thought about pheromones and smells and stuff and the barking, but just how one room affects another and from the whole chain of everybody in the practice, how they behave, what their energy, like how they greet animals. Yeah, very, very, really fascinating. Well, this has been a really, really great talk. I can already feel that we need to come back and do another one about more specific, more specific modalities. I'd love to do that with you. So I want to just thank you for your time. You have my head spinning. I'd also love to talk to you off camera a little bit about maybe some of the things we want to do with younger veterinary students or before they get into veterinary school. I think you could be really helpful with all that. Yeah, absolutely. I'd love to help with the next generation of veterinarians. Yeah. Yeah. Isn't that weird that you're talking about that already? It sounds very strange. I will not lie. Yeah. All right. Well, everybody, take a look. I'll put this the practice back up on the screen. hometownanimalhospital.net. That's where you can find Dr. Casper. And, I put doctor on the beginning of your name. I put it back on because you just put Gavin Casper, but okay. You don't want to put your name back on, but Dr. Casper is where are you in Florida?
In Weston, outside of Fort Lauderdale.
Weston, outside of Fort Lauderdale. So if you're in the area, we know a lot of really great vets in that area. So that's a great hub over there.
Yeah, we're very fortunate down here.
Yeah. So have a great day, everybody. Thank you for joining us. And Dr. Casper, until we meet again.
Absolutely. Thank you so much.
Thank you. Bye, everybody.